Hi everyone, and welcome to today's webinar. This presentation is being recorded and will run approximately 60 minutes, including question and answer time at the end, and will also be available in the Events Industry Council's Knowledge Hub. All attendees today will receive their CEs approximately 1 week after the webinar. Also, we're excited to announce that EIC webinars are also now eligible for CAE credits. Before I turn things over to our presenters, I would like to address a few logistical items. Attendees can listen to the webinar through their computers or by dialing in using the number and passcode provided by the Zoom software. If you have any questions, you do not need to wait until the end of the presentation to submit them. We encourage you to submit your questions using the box seen on the screen. We'll address as many questions as we can at the end of the presentation. We also welcome you to utilize the closed captioning function. Click on the CC button at the bottom of your screen and you will find the link to the subtitles. And now I'll hand things over to our CEO of Events Industry Council, Amy Calvert. Amy?
Thanks so much, Derek. Thank you everyone for making time for this important conversation today. We're so thrilled that we have a fantastic audience and really also very grateful to our panelists for making time for this important conversation. You know, we really believe as an industry that we have to form alliances and partnerships and collaborations beyond that which we have grown and nurtured previously to come out of this global crisis even stronger than where we were originally. And I think that's one of the key areas we want to focus on in terms of our conversation today. So I just want to thank all of you again for making time. We are really thrilled to be able to host the conversation and looking forward to some great questions after we get through some initial presentations. So I believe my first task is to turn it over to our esteemed moderator, Mr. Johnny White, CAE MBA CMP, to kick us off and introduce our panelists.
Thank you very much, Amy, and thank you for the invitation to participate in this webinar. I think this is going to be a huge and a great opportunity for us all to come together and hear from some experts in the field. And these experts are, not necessarily in the meeting industry field. They're experts that understand what's going on in this current time. So it's going to give us some advice on, how we should move forward in the meeting industry. So I'm excited to be here. I know we have over 3,000 people signing up, and they are coming from all over the world. So I'm looking forward to this dialogue that we're going to have with the panelists and being able to answer a number of your questions that you have out there. So please definitely give us some questions because we really want to answer those things, those dying questions that you have. So let's go right into this. What I'm going to do is I'm going to introduce each of the panelists as they begin their presentations. So first person that's going to be presenting is Amy Calvert. So I'm going to give the mic back over to her. Everyone know Amy Calvert is the CEO for the Events Industry Council. So Amy, take it away.
Thanks, Johnny. And I'm going to go through these pretty quickly to allow time for some conversation. So we can move on to the next slide. So just wanted to remind everybody, our organization, we are a global federation of industry organizations. And you see on the screen before you those industry organizations, and all of them have done really fantastic work through this crisis. I think one of the things that I've been most really grateful for and pleased to see is that these organizations have shown up in a really meaningful way for our 26 million global industry professionals and offering resources and education and virtual experiences to carry us forward as we learn more about COVID and how we adapt and transform from here. So I'm really super grateful to them. I think that, the piece about the Events Industry Council that resonates, I think, globally now is that this is an organization that really comes together to champion the events industry through advocacy and research and to tell our best story and to really think about what are the practical elements that we can implement to best serve our industry, not only during times of crisis, but pan-industry issues around education and sustainability and social justice issues. So a fantastic group of industry organizations that represents, 33 different members, but over 120,000 professionals globally. We can go on to the next slide. One of the things that we do on behalf of the industry and our members every 2 years is we embark on an economic significance study, and we really share this out. And it's been a fantastic tool in terms of advocacy throughout the globe in this time that we're in. We really, we use this as sort of the baseline to help people understand really not only the economic impact of events, but how business events drive business outcomes, but also build and serve communities. And that's the piece of it, I think, that is so important for us to remember. We're an organization, we're an industry globally that not only concerns ourselves with economic output, direct economic output, but also indirect economic contributions. And that really comes in many different forms. But investment in education and research is just one of those pieces. And, this pandemic has taught us that we must be able to tell our story and be unified in the message about the scope and scale of the global events industry on behalf of not only the 26 million professionals, but the communities that we serve. So we can go on to the next slide. We do take this data each by region and share this out broadly, and we've done a number of things to make this accessible and available to the greater industry through our website. You can find some advocacy resources there, not only the PDFs that you see up on the screen that talk about the global impact by region, but also some letters that you can use in your own advocacy efforts. So we can go on to the next slide. One of the things that we found that was really important as we started to think about how we could best serve the industry during this time was to form a task force. And this task force is really to look at the landscape and all of the resources that have been created around health and safety standards, protocols and guidelines, and to really be the great aggregator and curator of those resources. So the aim really is to look at this from a global perspective and to be able to share accepted practices, tools, and guidance that can be applied wherever your event might take place or wherever your organization might be based. And to truly look at the way in which we can take all these tremendous amount of resources that are available and the standards and apply them in real time and in practice. And the task force has done some really amazing work. We can go on to the next slide. But the first thing that we realized when we pulled together this group of over 40 global industry professionals is that we really wanted this work to be grounded in a core vision and some values. And we worked together collaborating amongst the task force on behalf of the industry. And we landed on the values that you see before you. And they are obviously trust, equity, community, and innovation. And, as we've gone through this crisis together over the past few months, I think we all realize that, our future and the foundation of not only getting back to the business of meeting face-to-face, but our long-term resilience and the future of our industry is really going to start with this idea of trust. We might have permission to meet face-to-face, and yet we need to consider what the experience will be and how that will be a truly investment of the resources put forth to do so. So trust, equity, community, innovation are the key vision and values for this group. We can go on to the next slide. And we looked at certain methods. I mean, I think we all know that, of course, there's tremendous interest and a need to be able to better understand the health and safety guidelines and protocols. And we've been on a bit of a dual path. We really want to take the great work that's been done, much of it by many of our members and other industry organizations and the great organizations represented here today on this call, and try to make sense of that landscape. But we also wanted to be on a bit of a more of a longer term path to really consider how this working group on behalf of the industry can really look at areas of community and wellness and how to best support the workforce in terms of the reskilling that might be necessary to adapt to what the industry will look like as we come out of this crisis. We're also really focused on supporting the global advocacy efforts that are underway, and there are many. But I think now more than ever, we realize this is an opportunity for us not only to come out of this this crisis stronger, but to really use it as an opportunity to come out of it a better understood industry. And again, I go back to, an industry globally that has tremendous economic impact, but also tremendous social impact. We can go on to the next slide. So again, this task force has come together to serve on behalf of our members in the industry and really curating, aggregating, and being the great explainers of these sectoral resources. And we've worked in several different, we're calling them living work streams. And you see before you the areas of focus. And we've really tried to apply those visions and that vision and those values to this exercise when we've been aggregating, in particular, the health and safety protocols around accommodations, venues, and transportation, and also risk mitigation and management. Our first release, ironically, we can go on to the next slide, will be in the area of meeting and event design considerations. So really we're going back to this notion of, there is a need for individual organizations, but also individuals to really be able to analyze their own risk profile. And that calls us to have a certain responsibility as individuals, as participants in the event ecosystem. So we'll be sharing with you in the not so distant future this resource, and it'll be available through our EIC channels. And I think it'll be a really important way for us to sort of begin this conversation around risk and how do we leverage the various resources that are out there to be able to not only assess our own individual risk profile, but that of our organization. And what does success look like? And how do we take the responsibility through duty of care and all of the commitment that we have made over the past few years of better understanding safety guidelines and ways to implement safe practices, communicate that to the various stakeholder groups that are represented in the process of hosting events, trade shows, incentives, and so forth. So we're really super excited and grateful to the team that put together this individual work stream, this meeting and event design guide, and really looking forward to being able to share it broadly with the industry in the next couple of days. We can go on to the next slide. I just want to wrap again that, the Events Industry Council is really committed to being on this journey on behalf of the industry from a global perspective and really trying to show up in a very relevant and resourceful way to support our members, the stakeholder groups that they represent, and of course the workforce. So I just want to thank again the panelists today for being part of this conversation. I'm really looking forward to spending this time with you, and certainly available afterwards for any conversation or questions that any might have about the Events Industry Council, but also the work of the task force. With that, I think I'm turning it back to you, Johnny.
Yes, thank you very much, Amy. And as a individual that's participating in this task force, I will say that we're working on some really, really good things. So I think everybody will be happy with the results that you'll see from these task force. So let's go into our next panelist. We have Dr. Maurizio Barbeschi, who's a senior advisor to the executive director of Health Emergency Program at the World Health Organization. Maurizio, I think a lot of people want to hear from you in terms of what guidance you have from the World Health Organization. So take it away, Maurizio.
Thank you, Amy, Johnny, and thank you principally to pronounce my name correctly, because I'm become Barbeschi for the rest of the planet, and I'm officially impressed by your prowess. I can't give much guidance, but I'm willing to share the efforts of being there on the front line and sleeping 3 hours and a half a night in a lockdown Geneva. Next slide, please. This is the last day picture photograph of the planet. So you have those green area, which is discounted by the 1 million inhabitant. So this is a snapshot of the tool we use to see how and who gets what, where the cases are augmenting and why they are augmenting. There are 3 phases on the planet as we see. The first one are those community transmission countries in which, like Brazil, the United States, South Africa, in which basically they never saw yet a decrease or a steady decrease from community transmission down to a small cluster of cases. And other parts of the world, like in the Balkans, you can see, or in Portugal, where you have, they managed to contain the virus, and now we have outbreaks back up again. Next slide. As Amy promised, I have a full set of slides which I can circulate, but I will use 3 for 2 reasons. One, it leaves more question for question and answer, as well. Amy used to say, there is a pandemic of people who takes themselves far too seriously. And second is a picture sends much more messages than my talks. So you can see obviously by color the bifurcation of the areas and the region of the world where we have the virus today. 2 takeaway messages. Never ever in mankind we had a new virus genetic code done in a week, in 10 weeks. Second, the containment and the alert of the planet in responding to these was breathtaking compared to the past epidemics in history of mankind. Was it sufficient? Was it what we need? Obviously, we are scrubbing the story a moment after the other, and the numbers are saying that we are successful in the areas, less in other areas. Next, please. Next slide, please. So there are, again, phases and countries moving from too many. One slide too many. Go back to the blue. Thanks. So in this societal environment in which we have countries entering and re-entering lockdowns, look at California today, or in countries where they thought they managed, Italy for instance, and you have flares of outbreaks to follow. And in what Mike Ryan said, my boss, my supervisor, you have a fire to control and then keep the fire at stock. There is no risk zero. We cannot stop being held in houses, mass gathering events. Your industry is crucial because it's between the Olympics or the NBA and the gym and the social and the church services. And you are in charge for us of that flag that is between the societal, the community tactical approach and the broader societal and industry meaningful economic sense. So is this ping pong, this moving dynamically between one situation and another in country and the other, because I'm here representing the South Africa, the Mali, the Thailand, and so on, not just the North. And here you can go to the next slide, please. It's where WHO, together with the various industry, together we developed risk assessment and tools by which you, each of you, I see 2,316 colleagues online that is hearing to these reflections. Each of you are making decision what to do and how to do it. There are 3 elements of this tool. The feature of the event, can you change it? Can you play in Disneyland if you're an NBA, or in Orlando, or in Champions League in Germany? Can you change the feature of the game, of your meeting, or your event? How you mitigate the measure, and so mask, distancing, contact tracing. Last but more important than all, how you communicate your decision to go or not to go to the rest of the public. Far too far in the past, decisions were taken without informing the public, and that did create anxiety, panic, and lack of sense of ownership by the communities. So I stop here, but I do wish to your comments and questions, because that's what makes our work much more interesting. So thank you for having us here, and back to you, Chair.
Thank you very much, Maurizio. There's some really good data there. So now we're going to go to the next panelist, Tiffany. Tiffany Misrahi. She is the Vice President of Policy of the World Travel and Tourism Council. Tiffany?
Thanks, Johnny. Good morning, good afternoon, good evening, everybody. And thank you, Amy, so much for inviting me to engage with you on this important conversation about travel and tourism events and COVID-19. Like Johnny said, I'm Tiffany Misrahi. I'm the VP of Policy at WTTC. Next slide, please. WTTC represents the global travel and tourism private sector, and for over 30 years, we've been conducting research and working to align the sector to speak with one voice to ensure fair economic policies and ultimately the sector's long-term sustainable and inclusive growth. Next slide, please. First, paint a picture of the performance of travel and tourism, of the travel and tourism sector before the crisis. We were doing great. The sector accounted for 330 million jobs globally, or 1 in 10 jobs on the planet. We grew faster than the global economy for the 9th consecutive year, with a 3.5% GDP growth of the sector compared to 2.5% of the global economy. And we accounted for 10.3% of global GDP. The situation is not exactly the same right now. So looking at the next slide, please. We looked at the potential impact of COVID-19 to date, and our latest research estimates that up to 121 million travel and tourism jobs and $3.4 trillion dollars in travel and tourism GDP are at risk according to our baseline scenario. This would mean a drop of 53% of international arrivals in 2020 and a 34% reduction in domestic travel. This is our baseline. Our downside scenario, which, as I was speaking to Maurizio earlier, may evolve as this pandemic is evolving. But right now, our downside scenario, where restrictions only ease in September for domestic travel and intercontinental resumes mostly in November, the losses in travel and tourism jobs could reach 197 million jobs and $5.5 trillion losses in travel and tourism GDP. That would be a 62% reduction from the previous year. Considering our sector has about 330 million jobs, the losses are tremendous and really huge. Moving on to the next slide.
I'm sorry, because this is some staggering numbers, and if we can go back to that slide, and you know, we didn't talk about me coming in and asking questions in the middle of a slide, so, but I want everyone to understand, you know, what you're looking at here. In this scenario, it could be even worse, I mean, as we talked earlier, or it could be better. I mean, I think that's something everyone needs to understand that too.
Yeah, I think, you know, when we did our first body of research in May, we found that about 1 million jobs were being travel and tourism jobs were being lost every day. And, you know, when we did our first analysis in March, we thought, you know, it's going to be 50 million jobs. And as it moved from being a crisis in China and in the Asia Pacific to being a global crisis, you know, our estimates and our forecasts have evolved. So, you know, right now we're obviously assuming a baseline scenario, but I think the reality is, and Maurizio is a much better place to speak to the medical elements of it, but, you know, depending on whether we have second waves, depending on how restrictions evolve, you know, these scenarios could evolve and could be worse. Our hope is obviously that we're able to bring it under control and that, you know, we're able to find a vaccine soon, and that hopefully, you know, we can minimize the impact in terms of job losses and GDP losses. We want to protect millions of people whose livelihoods depend on the sector.
Right. Well, thank you for that additional information. We can go to the next slide now.
Great. Thanks. So recovery can be time consuming, but our experience is that our sector is really resilient. We actually undertook a big body of work, which we launched in November 2019 on crisis readiness. And in that, we looked at 4 types of crisis. We looked at terrorism, natural disasters, geopolitical shocks, and outbreaks. And we found that for outbreak disease cases, the average recovery time was about 19.4 months to pre-crisis arrival levels. Every crisis is obviously different, but this is to give an indication. What we also found, which I found very reassuring, is that the travel and tourism sector is becoming increasingly resilient. Our research across the 4 types of crisis showed that between 2001 and 2018, the months to recovery decreased from 26 months on average to 10 months on average. So countries are learning from their own experience. They're also learning from the experience of other countries. And while at the same time, travelers are also becoming more immune to shocks and more ready and open to going back. So next slide, please. On this basis, WTTC has defined 4 principles for the travel and tourism sector's recovery. The first is a global, consistent, and coordinated approach to reestablish effective operations and reopen borders. The second is to enhance the existing seamless traveler journey by adding health and hygiene components and building on the latest technologies. And this is across the journey, including obviously meetings and events. The third, which I will focus on in a moment, is to implement global protocols defined jointly by the travel and tourism private sector, health experts, which we have here, and the public sector to regain traveler confidence. And the fourth is to continue supporting the travel and tourism sector, not just during the crisis, but through the recovery with enabling policies and financial aid. So please, going on to the next slide. WTTC believes that there are 4 critical phases as we reach full recovery. These are managing and mitigating the crisis, restarting the sector, reaching recovery, and redesigning for the new normal. While these 4 phases are in principle and sequential term, the preparations and actions will overlap significantly, and they will obviously require agility, which I think is key to this recovery. While the exact timing and duration of these phases likely to vary country and by region, strong coordination and preparations are needed based on the key principles and best practices. And in this context, WTTC is engaging with governments as they take leadership on the development of common processes and regulations in collaboration with the private sector to really enable travel and tourism businesses to resume business operations as soon as possible while protecting the livelihood of the sector's workforce. We believe that the ability to reach the next normal will be tied to medical breakthroughs, specifically a vaccine. And as we move to recovery, it will also be essential to define new global protocols. We need a common rather than fragmented national approaches, and public-private cooperation will be critical to jointly define and implement these global protocols to make sure that we can enable the seamless and secure movement of travelers across international borders. Next slide, please. To address this coordination challenge, create consistency, and rebuild the confidence of travelers, WTTC launched its Safe Travels protocols, and we brought together our members, governments, health experts, as well as industry associations and international organizations to help us draft effective recovery protocols to optimize the sector's recovery. We've launched 9 to date, including, among others, convention centers, meetings, and events. So moving on to the next slide, we found that there are a lot of commonalities across the protocols, which is why we divided them into 4 pillars, focusing on promoting operational and staff preparedness, delivering a safe experience, rebuilding trust and confidence, and implementing enabling policies. For the travel and tourism sector to recover from the COVID-19 crisis, event participants will need to feel assured of their own safety while attending events. In that context, we think it's going to be important that participants are clearly and simply advised of the new protocols implemented within convention centers, meetings, and events to ensure their safety. As Maurizio said, protocols should be developed through a risk-based approach, as should be the approach generally towards addressing the crisis, and should include, as appropriate, whether it's health assessments and screening, enhanced health and hygiene measures across the venues, including catering, availability of hand sanitizers, recommending physical distancing measures, the reevaluations of timelines to avoid queuing and bottlenecks, potentially the reduction of venue capacity, as appropriate, and as appropriate also hybrids to ensure and enable participants to engage virtually. Before I move on, please note that the protocols are freely available on our website, and obviously Amy and the team can share them with all of you afterwards. So next slide, please. As the sector moves and adapts to this next normal, adapting to the new world and new traveler, it will be important for the sector, both the public and private sectors, to one, determine the new requirement and expectations. And through data and research, the public and private sectors will have to consider what are the shifting trends and the shifting expectations and the requirements of each travel segment. I think COVID-19 should be used as an opportunity to bring to the forefront existing and emerging issues from the future of the workplace. What will that look like, to mental health, all the way to the future of immigration and visas if we're moving towards remote workforces, and of course sustainability, among many others. The second is to collaborate on revising existing and developing new policies. The private sector should collaborate with government, have a seat at the table, and most certainly be involved in the definition and implementation of new policies relating to the sector. Destinations should review crisis plans also and share best practices. The third is around embracing new technologies, whether it's biometric, address new and changing requirements and improve the participant or traveler experience and remove friction along the way. And I think from an employer perspective, COVID-19 will likely have accelerated the trend of remote work, and in turn that's going to impact IT and staffing and potentially require new training. And finally, as I've taken up enough of your time, we need to communicate honestly, promoting both domestic and international travel to revitalize the sector. And I think with trust as a key currency, all stakeholders, including travelers, will demand transparent communications and a better experience, particularly digitally. So next slide, please. And that's where I say thank you, and I turn it back over to Johnny.
Thank you very much, Tiffany. And great message and a lot of great data there. One of the things that I think was came out pretty clear is that we need to collaborate on a lot of the protocols. So that's good to hear. So our last panelist is Joaquim Nunes. Joaquim is the Chief Labor Administrator at the Labor Inspection and Occupational Safety and Health Branch of the government. So Joaquim, you're up.
Thank you, Johnny. So this is a very long acronym. So just in a nutshell, so I'm representing the International Labour Organization, which is the UN specialized agency working with labor issues and also with occupational safety and health. So I'd ask you please to show the next slide. And first of all, of course, thank you for inviting me to be here. So my presentation will be very much from a safety and health perspective, and how can different workplaces and specifically workplaces where the event industry operates can prepare themselves to get back safely into work when national conditions allow us to go back into regular operation or more or less regular operation. So the ILO has been providing assistance to our member states in what we call 4 combined policy pillars. So this is very much on stimulating employment, economy, supporting businesses, also strengthening social dialogue mechanisms both at national, sectorial, and workplace levels. So this also assists to build the trust, which many of our speakers already referred to. Yes, this is one of the solutions to bring not only workers willingly to workplaces again, but also, especially in thinking of the event industry, also bringing clients, customers back to the events that we organize. And the 4th pillar is the one on protecting workers in workplace through adequate risk assessment and risk management. And with this, I'd like to move to the next slide, please. So again, when thinking of an industry such as the industry where you operate, I think this is quite complex because you work in many different work settings. You work also on the organization of very different types of events. So you do have a multiplicity of operations that make it quite complex to try to standardize in terms of what would be the best solutions from an occupational safety and health perspective to bring back our workers and also have our public attending the events safely. So what we always say is that, again, each event is specific, each workplace is specific, each venue where an event is organized is specific, and for this, you always need beforehand to conduct a thorough risk assessment. So you will need to look exactly into all the operations, that will be undertaken. You will need to look into the workforce that you have, the specific knowledge that we have on the hazards they're exposed to, the preventive measures that they are exposed to as well. We need to communicate effectively with them so that, they're educated on the safety measures that we have to, comply with, but also, the safety measures that they have to inform the public, in terms of not affecting the safety of the public, but also of the workers themselves. Then again, I'd like to say that this has to be taken very seriously because, nowadays, when we deal with a biological hazard, such as, the new coronavirus, we know that, a single outbreak or a single infection in a workplace can have, devastating effects, in the whole community, in the whole region, in the whole industry. And again, it's also not only by implementing the adequate preventive measures, but also in communicating to all of our workers, to our clients, that these preventive measures were taken. I think this is essential. So to have a clear communication policy on what we are doing to in a way to have the events that we organize being as safe as possible. I'd like to move to the next slide, please, to say that this is why bringing occupational risk management to the whole cycle, the COVID-19 into the cycle of any other biological hazard it's quite important. So we have to think of all the occupational risks that we may have when we are living throughout the crisis. And this is because we have to consider not only the direct risks associated with infection, contagion, but also, as someone already spoke, the mental risks, the mental effects of, those that are working from home, all the stress that deals with uncertainty in terms of, for instance, keeping, the job. Also the fact that, when we work from home, we not always have, the most adequate, conditions of work because, we may not have an ergonomic chair. We may not have, a good screen. We may have to take care of children at the same time, of the sick relatives, etc. And all of this may add to the negative effects from a psychosocial perspective, which again may have, direct immediate effects on our health, but also, what I'm afraid, longer-term effects on the health of our communities. Of course, that when we start thinking of returning to work, we have to consider also, if all the measures are in place so that, we feel safe when returning to work. So we feel safe as employers, we feel safe as workers, and of course, we also feel safe as, the audience that will attend all the events. And of course, that when going into the recovery phase, we will not forget that, again, a single case of infection can have, devastating effects, in the whole economy. So we cannot forget that risk assessment and risk management has to become, a permanent operation in our own, management systems, in all that we do whenever we, organize our events. So as you may see there, the safe work practices anywhere nowadays pose a threat to health everywhere. This is also why on the right side of your screen, you may see that it's important that we address, the new coronavirus, as an occupational hazard, exactly on the same way that we address, and that we tackle other occupational hazards. And for this, it's important to follow a very well-established hierarchy of controls. It's this inverted pyramid that you see there that, lets you know that, when implementing, what we call preventive mitigation and control measures in workplaces, you always should look into, what is proven to be the most effective. And the most effective follows exactly this pyramid, We try to see if we can eliminate the hazard. So for instance, if you want to organize an event, can you have it online? And this may even, open new opportunities for business. And we have seen that, organization of conferences, webinars such as this one, may be quite successful if we do it online as well. The second step would be to look into the possibility of replacing something that is hazardous by something that is less hazardous. And there was already a good example here. Imagine that you want to organize a conference in Philadelphia where there is let's say an accurate growth of infections over the last weeks, and you can move this event into any other region where the rate of infection is lower. So the risk will be lower there. So you're replacing something that is hazardous by something that is less hazardous. Then again, when none of this is possible, you have always to follow the following hierarchy. So you have to look into what we call collective measures. So you have to look, if implementing measures for physical distancing, hygiene, the cleaning of the premises and equipment, etc., may be possible by implementing changes in workplaces. So implementing changes in the places where you organize the venues. And this may be very cost effective. For instance, when organizing ways of separating, so avoiding contact between people, especially if keeping physical distancing is difficult in many settings. Then we have to look into organizational measures, as also some speakers already mentioned. You have to see, if you can stagger, the hours of arrival, if you can, organize, one-way pathways to avoid people to cross, and also, so that it's easier for, possible, affected people to infect other participants. And then you look into the use of what we call, the personal protective equipment. Then you look into the, the wearing of masks, gloves, etc., depending on the function. And again, the wearing of personal protective equipment may be, may complement other measures, but usually this is not the most effective way of addressing, occupational hazards, because, the most effective way is always, to look for, what is a collective protection. Also because, what we see with experience is that not always workers use, the personal protective equipment that they receive, and not always they wear them, adequately. And this also may increase the risk that they are exposed to. I'd like to move to the following slide. Just with a very brief reference that it's not only the direct risk of contagion that we have to consider, and it's not only all the psychosocial effects that this pandemic, this crisis may have on our mental health for many different reasons. We also have to look into the interaction with other hazards, and also other hazards that may occur, or other negative outcomes that may occur because exactly workplaces were closed, operations were suspended. And we are seeing that in many different settings, the fact that, for instance, a given premise was closed for a couple of months, maintenance was not performed, and we do not have workers, being affected with COVID-19, but we have workers dying because of work accidents, because, again, systems were not maintained, systems, are down. And this is also something that, of course, we have to be aware of. I'd like to move to the next slide.
So just as we're transitioning slides, Joaquim, if you could come a little bit closer to your microphone, we're having a little trouble hearing.
Yes. So again, just to refer again to what I said before, that again, it's important to understand that every situation is different, and for every single event that we organize, we have to consider all the different work components. So we have always to assess exactly all the risks that we may have, and we have to assess all the risk factors. And this is not only looking into, again, the premises, the equipment, the materials, but very much also the specifics of the workforce, and the way that the workforce is or is not educated to adopt any preventive measures that may have been communicated to them in order to avoid, a contagion. And this is also why you see also the reference there, that it's very important for us to, define, a very clear communication policy, but also to effectively communicate with all our collaborators. So not only our direct workers, but also, the many, many, many different, workers and people that we may have assisting us to organize and to go throughout, a given event. And in some cases, I know that, the event industry, at least in my own country, for instance, when organizing shows, etc., we work with volunteers. So, of course, that, we have, for instance, volunteers working, in the premises where we are organizing an event. All the safety measures, apply to them as well. And all, our communication policies and mechanisms will also have to, apply to these volunteers or any other person that is working with us to organize a given event. Just a final word before I'll just give you the references there where you can find this information. It's paramount. It's a fundamental importance to engage with workers. It's a fundamental importance to ask workers of the risks that they perceive the different operations that they'll have to undertake when organizing a given event. It's very important to engage the workers on selection, the most adequate preventive and control measures. And it's even important to engage the workers when selecting, for instance, the right type of masks to wear, so that, these masks, of course, if technically correct, they'll be, the most comfortable for them to wear, so that also, this decreases resistance that we often see, on the side of workers on adopting safe work behaviors. So with this being said, I'd just like to give you some references on where to find this information on the next slide, please. Next one, you'll just have, some practical tips here on preventive measures to adopt during events, but the slides will be available, I think, and we can also go through this, when we have the questions and answers. Next one, please. Again, the same, specific measures, restaurants, dining rooms, bars, etc. Next one, please. And so this is a list of many of the policy and technical tools that we have been developing in terms of, assessing occupational hazards related to COVID-19 in workplaces, not specific, again, to the event industry. But I'll say that they are comprehensive enough to be adapted to any work setting. Also some tools that address the mental health effects of going through the pandemic. And the last one, which is, our 2001 guidelines on occupational safety and health management systems. And here you'll find very concrete and very comprehensive, details on how to implement, an OSH management system in any kind of work setting, including, in the event industry. This is also where you can find more information on exactly how to follow these, famous narrative controls. So I think it's an important reference to review with. And then finally, of course, as we are a normative organization, on the next slide, please, some reference to our main standards on safety and health at work. And it's also important to have a look, into these, because these are the standards that globally, define the main duties and rights of employers and workers when dealing with safety and health at work. These are also the standards that bring you, some advice on how to implement, safety and health measures in workplaces, but also these are also the standards that advise governments, employers, and workers' organizations on the main elements that should inform any policy that they have on occupational safety and health. Then also some reference to specific sectorial standards. And just before I leave you to mention that we are currently working on a new technical tool exactly on accommodation and food that is applicable to food services, that is applicable to your industry, and this will be available hopefully within a week. And again, I can also provide you with reference when time comes. Thank you very much.
Thank you very much, Joaquim, for that information. Some really good information to help us in working with our workforce as we go through this time. So I want to thank everyone for their presentation. And now we're going to get to the juicy part of this town hall, and that is the questions. We received a number of questions prior to the program, so I want to get right into those. And I have some questions specifically for Maurizio that I want to start with, and then each of the panelists can also provide some comments too. So Maurizio, the first question I have for you is, what do you see as the greatest challenges from COVID-19 for the events industry? Maurizio, you there? Well, while we try to get Maurizio back on, Tiffany, what are your thoughts on our greatest challenges for the event industry while we have COVID-19?
Well, I mean, I think the reality, and it's not just for the events industry, I think people are a lot more concerned about travel. And it's one, there's the travel restrictions and how that's going to evolve. But two is, I think there's also the element of companies who I think are going to increasingly limit in non-essential international travel. And non-essential travel to protect their workforce the same way they would say, be careful when you travel to a high-risk country in general, or they used to in the past. I also think at the same time, there's obviously going to be different elements and costs that are going to need to come into place in terms of, how does the event industry prepare from potentially the use of touchless technologies to decreasing capacity, and what does this mean in terms of business continuity, also thinking about health and hygiene and distancing. But for me, the big ones are very much going to be linked to people feeling safe, and how are we going to make sure that they do, and work with government as travel advisories to countries play a key role in how people decide whether or not to travel, to go to events and conferences, but also just to travel for leisure.
Yeah, Tiffany, you bring up some good points. You have to think about the traveler and ensuring that they're comfortable traveling. Maurizio, I see you're back. So the question I had was, what do you see as the greatest challenge from COVID-19 for the events industry?
That's it? That's such an easy question, right? I saw some of the questions online, and each of the questions is asked by a colleague who sits in a specific part of the world, in a city or in a small village. And one first take-home message is, I would suggest to have a risk-based approach. So wherever you are, whatever event you're thinking having, you should really try to think, how can I modify the event? How can I do a risk assessment? Which mitigation measures are allowed? And last again, if I take a decision, how I communicate it to my audience, to my customers, to my community, is nothing worse than taking decision without explaining to them. That is the lesson learned for first time in mankind. Thanks to you folks, there is a set of tools out there. Anybody is making decision using the same tools all over the world, whatever you do, sports, events, religious. Of course you tailor for your city or for your event, but the mothership, the motherboard is all the same, and we should really springboard from that. Such a single risk is how you handle, each of you handle the risk. Johnny. Over.
Well, thank you, Maurizio. And you touched a good point there. We have to communicate appropriately to the attendees, those that are coming to these events. So switching gears, but still talking events, Joaquim, what are your recommendations for assuring worker safety with events returning? Let's talk about the workforce.
Returning to what? Johnny, from where. So if you are a meat packer, obviously it seems that you have, at least in Europe, higher risk, let alone the nurses and the doctors or the bus drivers, which has to have protection against the rotating. So I'm not in WHO in general, and we are never go into specific recommendation because we can't. We don't know the specific of the place, the baseline of the population, which disease they're prone, what the vaccinations are. What we try to do is to have the broadest possible suggestions, consideration that can help you, the local people, the local authorities, to make the best informed decisions. So it would be silly to you if you just say, look, think on the mask or think of the distances. The success story in countries have all taken the combination of those things together. It's the contact tracing, the isolation, the masking, the protection, the societal help to bring food to those that are locked down, and so on and so forth. Any of those measures taken separately or asymmetrically were those country or community who didn't do that well. Over.
You bring up a good point. As you probably have seen in the news, there's controversy about wearing masks here in the U.S. They're just, they feel that they shouldn't have to wear a mask. Again, I know you said you can't make strict recommendations, but do you recommend, for events, everyone wearing masks?
The WHO recommendation as it stands, based on evidence, as you know well, our recommendation evolve according to the more knowledge and more knowledge. At the beginning, we said masks are only for doctor and nurse or medical. Now, with more evidence coming out, then we improve the recommendation to say masks are also advised for those people operating in elevators or in places where you cannot have the at least 1 meter distances, or those people that are to be exposed to other people for a long time. The first 2 cases of the pandemic in Geneva, the past pandemic, was the passport control officer and the person at the library giving books to the people. So this is, of course, an indication that those colleagues, those workers exposed to a lot of public, especially in confined place, can carry another risk. And that's where the mask is a solution. Again, all of the 3,000 of you online, please do think on your own risk assessment. The mask is a tool together with washing your hands, taking your distance, watch the others if they are sick or not. So the mask alone or any measure alone is not other than a tool. So mask when you think you need, not overwash your hands, not over mask, not lock yourself in a lighthouse for the fear. Over. I'm making, of course, communication tools. You understand exactly what I'm trying to say. It is the combination of the measure that helps you, Johnny.
Absolutely. So Maurizio, I know you have a hard stop. You won't be able to be on for the remainder of the webinar as we go through some of the questions, but what would you like to leave us with?
I am still 5 minutes. So this is the moment, folks, when my this 9 o'clock is 7:30 in the afternoon. But those ways or those moments where I am exposed to you all and I can have this chat, I can take your question, is the really high point of my day. Because it's not just the science, it's not just the tools and the recommendation or the politics. It is truly to be able to listen to your concerns, talk to you at first hand, and share what our experience was. At the end of the day, you are the one that goes in the front line and carrying the flag. I'm just the quarterback, if you wish, which doesn't take any hit, and I have a lot of Johnnies and Amy around me getting the hit from me. Is truly valuable for us to listen those concerns and things. I'm hearing from Chiara, can you close the door? Can you close the window? I'm asking kindly my daughter, she's in the back, to close the road. Grazie. So this is the moment where you start listening. I just scrolled through the 67 question and answer, and some of those is remarkably, they are so practical, so common sense. You are the real hero in the front line. So at the end of the day, you're balancing a business with your family, with your community, and try to provide those services that these past 6 months proven to be crucial to our sanity, not just economic sanity, but the real communal, the post-pandemic society we all will be living with. Over to you, John.
Thank you very much for that comment there. I'm going to switch gears and go over to Joaquim. We talked about the safety of our workers. Do you have any recommendations? As you know, a lot of the individuals that are on the call, they manage large convention centers and hotels, and they're going to be bringing their staff back. Any recommendations to make sure that these workers are safe beyond maybe some things that Maurizio had said?
Yeah, thank you, John. So my main recommendation would be not to bring them before being sure that the workplace is safe. And this means that, of course, in every country, every state, every industry, will have, defined policies, defined guidelines, legislation that, of course, all enterprises will have to comply with. But again, as Maurizio was saying, these are always general and not specific to each workplace. So if I have an hotel, if I have a restaurant, if I have, a pavilion where I organize, sport events, it's my obligation to look into the precise, details of of the whole, meaning, I need to look into all potential hazards, of infection, dealing with infection with the new coronavirus that have to do, with the way my premises are designed, that have to do with the equipment I have, that have to do, with the, policies I have in terms of access of people, to my premises, that have to do in terms, again, the fact that I have, direct employees, or if I subcontract my services to different, service providers, that may also increase the risk because, I have to be sure that, the collaborators or the workers of my service providers, also comply, with my safety rules. So I have to look again into also, the characteristics of my workforce. I have to know to what extent my workforce is informed of what to do, to protect themselves. So, this could be my major remark here. Again, I have to thoroughly assess the risks of my operations, and I have to, continuously assess the risks of these operations, also because the contract may be evolving. And again, I also have to be, updated, on, scientifically and technically, on, ways of transmission and what's happening in my region and state, and, potential, contagion I have, in competitors, So this is, in a nutshell, I think the most important. Do not bring the workers if you think that you're not sure that they'll be safe, because this can be even more disruptive to your business, in the long run. And above all, before bringing the workers, you thoroughly assess the risks you have in place, and again, if possible, involving the workers, safety committees, workers delegates. You also identify the most adequate, preventive measures, to put in place. That will not rely exclusively on the wearing of masks, etc., but also very much on the reorganization of the workplace, so that all the recommended measures in terms of physical distancing, hygiene, etc., may be easily complied with by workers.
Johnny, this is a comment on Joaquim cannot be more right. the whole UN is organized by the Crisis Management Unit. I lead the number 9, Pillar 9 on mass gathering. And after the acute phase of guidance, I realized that we couldn't go without ILO or travel or tourism or all the other industries. So we broke the UN bureaucracies and we start to work together despite the UN or despite the bureaucracies. And we exchange guidance because what you guys, you participants, you in the first line observe and experience is not just the worker, just the owner, just the traffic, just the fast food or the toilet. What about the kids? So you experience the whole reality, which we apportion falsely because of bureaucratic and so on. So you have a big problem as a whole, and we have to provide you ideas as solutions, like Joaquim did. And when I suggested to bring the union in the football, the FIFA, the soccer, at table to do the guidelines, I was looked like an alien. And they said, look guys, at the end of the day, the players are workers. Could be very rich workers, other are less. So any guidance that doesn't have the workers' perspective sucks or will be fought. So at the end of the day, these are the conversations, folks, that really enrich. I wish to have this recording, Johnny and Amy. Mm-hmm. We should have this webinar done for Africa and the South, in Spanish for South America. This what is the seeding and the beauty of all of you together for the post-pandemic that we can share with the rest of the planet. So I really wish to have you guys in the next wave. This is what will make a difference. Over.
Absolutely, and it goes back to communicating and doing on a global level. So, Percy, a burning question here that I know a lot of people would like to know, and I don't know if you know the answer to this, but what is the realistic timeline for a vaccine? Because as we heard from Joaquim, don't bring your staff back basically to minimize your risk. Well, everybody's now going to be looking for that vaccine to happen, and then maybe you can bring back.
No, John, not bring our workers. Do not bring our workers if you feel that the workplaces are not safe yet.
Yeah. Yes. No, I paraphrased.
Right, that's beauty. So we are just coming out of the way of no vax. Then everybody's waiting for the vax to fix it.
Yes.
We don't have yet a clue on which one of the many, many avenues research is bringing which vax will be the vax. Mm-hmm. You can have a Ferrari vax, very expensive for you, or you have a 50% vax that is perfectly good if you're very elderly or you work in a healthcare workers. So in a sense, you are working at risk, and for you, 50% chance is already a wonderful chance. Anybody terminal with 50% chance of vax will take it. Would that give it to your kids? Or what about the north-south? Would you give it to the most populated part of the earth? Or so any vaccine or any medical solution carries ethical, scientific, and so on. So when you hear anybody saying, I have a solution, is like those far west medical people carrying the medicine for the solution to everything in the back of a truck.
Mm-hmm.
In the back of a
so I guess I'm just going to add this as maybe a generous question, because it's something that I've been really interested in to see and has evolved over time. So a lot of the private sector companies, whether they're hotel companies or transportation companies, have done a really nice job at partnering with international medical institutions, health institutions, to try to better understand, what are the opportunities to bring people back safely when it is appropriate to do so, right? And one of the things that they've done a nice job at communicating is this commitment to the health, the medical component, but that's inclusive of their, the mental health and the wellness of their workforce. And I really hope that in terms of our long-term resilience and adaptations, that's something we continue to work on, particularly in the hospitality sector, where, the frontline workers are really those that bring the experiences to life, so they have to feel comfortable, feel engaged in that process, and to really
Do it.
yeah. So I guess and then there's the other side of it, which is there's the economic reality for all these people right now, and that contributes to mental well-being. And when we really
do it, Amy. It's a community in Saudi. You see the rugby in New Zealand today. There's full stadium.
Yeah.
Full people cheering, mother and children, because they fought every mask, every elevator, every bus stop. And the result, they can go to the stadium and cheer all up together, or go wedding together, or go.
Yeah.
So is this relationship between individual decision making and the ownership of the result that will lead this post thinking of the pandemic, this post society, as you said.
Yeah.
But not any of us alone. Is totally the combination of efforts. I totally agree. I cannot agree more. I believe it.
I really think so. I mean, at the end of the day, we have personal responsibility, right? And if we are concerned with our workforce, then we need to be concerned with our own role in the protection of, our industry through that, that commitment. And there's some lessons learned globally, I think, that we can all look to in terms of what's happening here in the U.S. right now. There's no doubt.
Yeah, and it's Joaquim. I think Joaquim, you wanted to say a few words. Go ahead.
Just to add something, just to build on this, also the more informed, why Maurizio?
Guys, sorry, Joaquim, forgive to interrupt you, but I really do think that this was totally beautiful, better than working actually. And I need to rush to feed the kids. So sorry for that, Joaquim, and we'll take it offline, but thank you for your remarks. It was totally enlightening and right on the spot. Okay.
Thank you
for being here. I'll talk to you soon. Send us a picture of your
risotto.
Your risotto.
Yes, we want to see the risotto that you're making. So Joaquim, this is a big topic here. We're talking about workforce and that sort of thing.
Yeah, building on that, the more informed workers will be, the risks they are exposed to, but also know what, the enterprise will be doing, to protect them against these risks, the more comfortable they will feel on going back to work and staying at work. And also just, as well, kind of an confidence, when we say that it's important to look into the workplaces and look into changes we can implement in workplaces, and sometimes, it's very simple, like, especially, to frontline workers, we install your barriers, your plexiglass-free screens or, any other kind of material to avoid the direct contact with the client. This is important not only because, of course, it protects them, or it increases the level of protection against, contamination, contagion, when, possibly getting in touch with someone that may be infected with. But also, mentally, psychologically, this worker will feel more protected than just wearing a mask, because he will know that, in addition to the mask, or even if he doesn't have the mask because it may not be required, there was a very precise measure that was implemented, on his workplace or her workplace to protect him, against this hazard. And this psychologically, it's quite important. And this builds trust, in terms of the workers getting back and giving their best, to their employer, trust.
Gotcha. Well, thank you, Joaquim, for adding that additional stuff. And I put you on the spot in reference to the workforce, saying, don't bring them back. I did that purposely so that we can talk a little bit more about that, because I think, in this industry, we're looking to bring people back, and we're trying to figure out ways that we can do that. So, switching gears a little bit here, Tiffany. So, a question for you: how are the travel tourism companies approaching contracted liabilities during this time?
Yeah, that's a complicated one, and I think different companies are approaching it differently. But I think that travel and tourism companies will increasingly collaborate with like-minded partners across the travel and tourism value chain. I think it's going to be really important for them to know who they're working with and who is within their supply chain and how they approach things. In terms of liability, I think, companies, as has been said, will take a risk-based approach, and I think they will map out their liabilities and responsibilities altogether. In a second instance, companies will also need to enhance their communications with travelers and guests to make sure that the guests are clearly made aware of the travel operators' responsibilities, but also the responsibilities of the travelers themselves. I mean, this is a really, really complex field, and I'm no deep expert, but kind of those would be the high-level points I would raise.
So, in following up to that, and how does the industry rebuild the trust in the travel and events industry?
I think it will be, ultimately, and I've said this, and it's been said by the other panelists as well, it will be really important to make people feel assured of their own safety, ultimately. And I think, participants are going to need to be clearly advised of what the new protocols are being put in place. And in that context, clear and consistent communication is going to be key, both digitally ahead of any events, but also in person. In convention centers, like physically, so people understand and know how to achieve their safeties. I think, ultimately knowing that countries, but also different companies are taking a risk-based approach and considering all the different elements when bringing people back is going to be really important. I think there's also an element of training the workforce to answer participants and guest questions and informing guests about the support available if questions or concerns arise and being able to resolve challenge. So I think a big part is working to figure out the answers, but then really communicating them, whether it's through emails, digital, in-person signage, but what are you doing, and then showing people that you are doing it.
You touched on digital. Amy, what do you see in the future? Is hybrid events going to be part of the future? As I see in the chat, there's questions of, are you going to go to this event? And I heard EU's having events, and then I'm hearing that, they also have the opportunity for you to stream in. Future-wise for events, is it hybrid's going to be the way to go, or what's your thoughts?
Yeah, I think hybrid is a really wonderful solution for a number of reasons. In times like this, of course, where, I think to Tiffany's point, we have to meet people where they are and have empathy and a respect for where people are. This crisis is going to live in people's consciousness for some time now, and with good reason. And so we have to, as organizers and strategists, think about how do we make space for all of those that want to participate in our events. I think we're an industry that commits to the values of inclusivity, and we're striving to be more accessible. And I think hosting of hybrid events and to becoming great, just the great experts in that regard, finding new ways to create engagement and to make that a valuable experience is definitely part of our future, and rightly should be. So I think it's exciting. I think that there's so much opportunity for us to, reflect on what this pandemic has taught us about those very things, and to consider, value creation and what experience we're offering to our attendees. And to be able to communicate, I think, is a really important piece of that. And, the opportunity to come away from this more resilient and relevant, I think, is there if we're open-minded about not necessarily driving back to what things were, but really embracing and accepting the path before us.
Right. And Joaquim, as we're going back to workforce, what do you think would be the long-term impact of COVID-19 on the workforce? What do you see the future workforce looking like?
Yeah, I think, we have to play with different scenarios we may have here. I think, the worst now for the workforce, for workers in general, is really the uncertainty. The uncertainty about employment, job losses, how the industry, not only this industry, but how industries in general will evolve. And again, we don't know. Well, some countries are now going through the crisis. Some regions, like Europe, for instance, have now started to reopen. Some other countries are not yet even on the crisis. We don't know if there will be a second wave, if there will be a third wave. of course, until we have, a cure or vaccine, the virus will be with us. We don't know exactly the herd immunity when this will be achieved. So I guess I'm very concerned not only with the direct effects on the health of workers, well, and people in general, in relation to contagion, infection with the virus, but very much the mental health effects, because this can have, and I think that this will have long-term effects, for all of us. And not only the mental health effects, and I'll give you my own example. Now, just as this week I'm back in the office, but I was working from home for the last 3 months, and I was working, with my small laptop, my small screen, and I can tell you that after 3 months, I was having problems, with my eyes. I couldn't read anymore, and I guess that if this continued for a couple of months more or more time, of course this could have again a negative impact on my health, in the long run. And again, all the consequences of confinement, being locked at home, in terms of socializing, man is a social animal, and again, this, I think at the end of the day, it's something that we'll have to look into, maybe when we go into the so-called new normal, and, when we know better, exactly on how the situation with COVID-19 will evolve. But the mental health perspective, I think this will be with us for many years to come. And I think this is something of which all of us, organizations, employers, workers, have to think about.
Right, absolutely. So we're coming down to the end of the time here. One comment here, though, in terms of looking at the future of the workforce. I think there's something else that we're going to see is a reskilling of our workforce. We are working in a different time. As you stated, people are working from home a lot more. So that's a different type of work style. As you said, you're going blind. Over-exaggerated there, but but that's just
Definitely Zoom fatigue.
Yes, but we're going to have to rescale. Amy touched on hybrid events, so individuals are going to learn how to manage hybrid events appropriately. So you got to learn, what's the steps in doing that. So I think from a workforce standpoint, we're all going to be reskilling in order to better serve this industry when it comes down to meetings. So with these last couple of minutes, I would love to just go around to each panelist and, give us your last thoughts here. Tiffany, I'm going to start with you.
It's tough to bring it all together, but I think, ultimately nothing is permanent. I don't think that, I think the meetings and events industry will transform as the world does, but it will find its next normal. I think what we've seen is that the problems that we're facing and the challenges that we're facing today are too complex for any one stakeholder group to do on their own. And that's why I love this conversation, because it brings together experts from health, experts from the events industry, experts, from labor, and across the board to really address and try to find solutions to these challenging pieces of the puzzle. What I do think is, you're going to need both the private sector, but also travelers and guests to play their part in making sure that the travel and tourism sector can survive but also thrive. And while the next normal may not be identical to what we're facing, what we have today, I think hopefully we can find a place where we're addressing important issues like mental health in a meaningful way, and make the travel and tourism sector even more sustainable, and look to that kind of next phase as an opportunity to making the travel and tourism sector even more sustainable and inclusive. So that's my goal.
Thank you, Tiffany. Joaquim?
Well, from my end, just because you said that, I said that, we cannot go back to our workplaces, just to leave you with a positive perspective, I think that, again, if we manage risks correctly, of course, it's possible that, we start our operations, within the new normal way of doing it. And the new normal way of doing it, of course, will require us to incorporate, again, risk assessment and risk management as a core aspect of all that we do. Again, all the operations. And again, not only in relation to, the physical efforts, to organize, events, but also, to all the work that we do, using, the new technologies. And even when thinking of, of the physical presence of workers, in the events that we organize, again, if we do assess correctly the risks, and again, if we do implement, the adequate, preventive and control measures, then again, if we do educate our workers and our audience on, safe work procedures and the protocols that are in place, I'm sure that the industry, will be running up on their feet, as soon as possible.
Absolutely. Thank you very much for that. And Amy, what was your last words here?
My last words, Johnny. So Maurizio, he had to drop off, but he and I talk often about this idea of the collective consciousness, right? So, and I'm so intrigued by that. We've been talking about this over the past few months, and my thinking around this is that, we've been, and it's been a huge challenge for so many, but we've been put on a bit of a pause and been given a bit of an opportunity to reflect on where we've been and where we want to go. And I think we have an opportunity here together through this collective effort and this collaboration, and this is just one example, to really be an industry that works in an aligned fashion to support, the transformational change we were talking about prior to this crisis. We were talking a lot about our commitment to sustainability and social impact. And we were talking a lot about, really creating valuable experiences and unifying around advocacy on a global level. I think one of my key takeaways from all of this is while we do a fabulous job at sharing the data around our industry and the business outcomes and impact, we haven't quite captured the hearts and minds of the policymakers to the extent that we need to do so. And we really can do that, I think, by humanizing our story and really sharing the social impact. So, my hope is that we continue to really operate in a united fashion to work through the most challenging times that are ahead of us, but focus our efforts long-term about, and looking towards those adaptations and transformations that will allow us to come out of this stronger and more relevant.
Absolutely, Amy. That was great advice there. I think in order for us to be able to get out of this in one piece and better is being able to work together. And I want to applaud the Event Industry Council for bringing these experts together, and then also the task force that they have put together. There's going to be a lot of good information that's going to be coming out of the Event Industry Council. So, be sure to everybody look at that. This is only the first of many webinars that will be happening throughout the time. So again, I want to thank Amy and the entire organization and our panelists for giving us some really, really good information. We could have probably went another hour. Unfortunately, we don't have that much time. So I want to thank you, everybody, for being here, and have a great day, evening, morning, or wherever you are. Thank you.
Thanks, Johnny. Thank you, everybody. Thanks for joining us, to all the participants. Be well.